Hi, my name is Deidre Bailey, and in this presentation we will be discussing pulmonary surfactant and its function. Let's begin by answering the question, what is pulmonary surfactant? Pulmonary surfactant is a combination of lipids, proteins, and carbohydrates that are found in the fluid lining the alveolar surface of the lungs. This combination works together in order to decrease the surface tension between the air and liquid of the alveoli. This is due to its amphiphilic complex containing both hydrophobic and hydrophilic groups. Pulmonary surfactant plays an essential role supporting air breathing. Now that we have defined what pulmonary surfactant is, let's discuss its function. The primary function of pulmonary surfactant is to reduce the tension within the alveoli at the air-liquid interface. This tension is reduced by forming a surface film consisting of a monolayer. This monolayer is rich in bilayer lipid protein structures and other substances which are closely attached. The reduction in surface tension helps decrease the work of breathing, which prevents the alveoli from collapsing at end expiration. Pulmonary surfactant also works by interacting with pathogens, preventing their dissemination, and modulates immune responses. Now that we know the function of pulmonary surfactant, let's move on and discuss how it is produced. Pulmonary surfactant is produced by the alveolar type II cells, which are found within the lungs. Phosphatidylcholine and phosphatidylglycerol are the major lipid constituents of pulmonary surfactant. SPA, SPB, SPC, and SPD are the proteins which make up this combination of lipids and proteins. Before the proteins are lipids are packaged within the lamellar bodies of the alveolar type II cells, they are synthesized separately. Complex genetic and metabolic mechanism regulates the synthesis, secretion, and recycling of surfactant lipids. When the homeostasis of surfactant is altered, the insufficiency of surfactant leads to diseases of the lungs. Newborn respiratory distress syndrome is a condition in newborns that is caused by an insufficiency of the pulmonary surfactant. Newborn respiratory distress syndrome occurs in infants that are born prematurely and need extra oxygen or help breathing due to underdeveloped lungs. Respiratory distress syndrome occurs when the baby does not have a sufficient amount of surfactant in the lungs. Surfactant is made in the lungs at 26 weeks of pregnancy and keeps the lungs from collapsing. More surfactant is produced as the fetus grows. Although respiratory distress syndrome is commonly found in premature infants, there are other newborns that can contract this illness. Infants that are twins or multiples, born through C-section delivery, those whose mother is a diabetic or have siblings infected with this illness, are all at a higher risk of contracting this disease. There are also other factors that may put an infant at a greater risk. In order to diagnose an infant with newborn respiratory distress syndrome, a medical examination, chest x-ray, and blood tests are all performed. There are treatment options for infants that have been diagnosed with newborn respiratory distress syndrome. In order to treat this condition, surfactant may be given to the infant in order to replace that which is missing. This can be given through the breathing tube, which is placed in the windpipe of the infant. Other treatment options include providing the baby with oxygen through a nasal cannula or CPAP. IV catheter treatments use a small catheter and places it into the blood vessels of the umbilical cord. Medications such as antibiotics are given if an infection is suspected, and common medications are provided in order to reduce pain. Now that we have discussed how an insufficiency of pulmonary surfactant can affect an infant, let's now discuss ways in which it can affect adults. Acute respiratory distress syndrome is a condition that arises in adults due to insufficient pulmonary surfactant. Acute respiratory distress syndrome is the result of a buildup of fluid within the air sacs of the lungs. When this buildup occurs, the lungs are not able to fill with enough air, causing organs to become deprived of oxygen. This condition typically occurs in individuals that are critically ill or have significant injuries. This condition can be caused by underlying conditions such as sepsis, inhalation of harmful substances, severe pneumonia, head or chest injuries, COVID-19, or other illnesses such as pancreatitis. In order to diagnose someone with acute respiratory distress syndrome, a physical exam, chest x-ray, and oxygen levels are all evaluated. Heart tests such as electrocardiograms and echocardiograms are also performed. There are several treatment options available in order to treat this condition. Supplemental oxygen through a mask or the use of a mechanical ventilator may be used in order to get more oxygen into the bloodstream. Fluid management is also implemented in order to manage this condition. Medications may be used in order to prevent or treat infections, relieve pain or discomfort, prevent blood clots in the legs and lungs, and for sedation purposes. Now that we have discussed the roles of pulmonary surfactant, let's dive into some research that was conducted on pulmonary surfactant in adults. Surfactant plays an essential role in pediatric patients that are diagnosed with respiratory distress syndrome. Because of this, it has been questioned whether or not surfactant can be useful in adult patients with respiratory distress syndrome. A study was performed on adult patients in order to evaluate the effectiveness of surfactant administration on those diagnosed with acute respiratory distress syndrome. In this study, randomized controlled trials were performed on adults 18 years or older. In these trials, surfactant administration with general therapy was compared in adults with acute respiratory distress syndrome. The primary and secondary outcomes were mortality and oxygenation. In order to properly evaluate the study, demographics, surfactant administration, and outcomes were retrieved. Other methods, such as funnel plot inspection and grading of recommendations assessment, develop an evaluation methodology, also known as GRADE, were utilized for proper evaluation. Based on this study, 11 randomized controlled trials were identified in 3,038 patients. The results showed that surfactant could not improve the mortality of adult patients. The analysis tools used, such as GRADE, identified that there was no firm evidence of a beneficial effect. This study concluded that surfactant administration did not show a noticeable or any improvement in mortality or oxygenation of adult patients with acute respiratory distress syndrome. This study believed that a study with a larger group has to be performed in order to determine whether surfactant can play an essential role in individuals with respiratory distress syndrome. In this presentation, we discuss what pulmonary surfactant is, its functions, how it's produced, conditions in newborns and adults that is caused by an insufficient amount of pulmonary surfactant. We also discussed treatment options and diagnostic tools used for each of these conditions. We then discussed research that was based on whether or not surfactant can be useful in adult patients with respiratory distress syndrome. Thank you.